Hello, and how are you? My name is Winnie Barawa, and welcome to our session on Aims of School Health Program. If you're new here, welcome and remember to subscribe or click on the subscribe button so that we can actually be notified or you can become a member of this channel. And if you're a returning subscriber, thank you so much for building this channel. Keep commenting, keep sharing our work and be part of us. Do not leave. So in today's class, I just want to briefly check through on what are the aims of actually establishing a school health program. We have introduced this program and we've said this is one of the areas that in healthcare, most health professionals are not actually, putting their effort or specializing in. So if you like school health, it's an interesting place. So let's look at the first aim of a school ed program. Well, number one is to provide optimum educational experience. Remember, students go to school, but again, the agenda of going to school is to help them, get maximum of their school environment or their school participation. So the purpose of school ed program is to therefore help the students attain and maintain an optimum health status so that they can also receive maximum benefit from the educational experience. No students wants to go to school and fail. Every student wants to go to school and pass or acquire maximum grades or become the best in their school. So when you put effective school health approaches or school ed programs, then it means you are actually promoting the chance for the students, or you're giving an opportunity to these students to have optimum education experiences because they'll be at peace, they'll be psychologically settled, they'll be able to concentrate and be able to learn. As opposed to if the environment is toxic, it's unhealthy, and it's not even safe for these students. And the other part is positive health. School health program is known to promoting development of positive health attitude and practices. When we teach school or when we teach health programs in our school, when you provide these health initiatives to our schools, children are able to adopt good behavioral changes, and this includes positive health attitude and practices. And some could include even personal hygiene, be able to clean up, be able to groom properly, teeth brushing, cleaning, hand washing. All these are practices that are healthy and they have positive outcomes in the lives of our students. Because number one, it can help us prevent infection, it can help us prevent risk behaviors that can hinder the progress of the students. So with proper health programs, then we end up developing positive health aspects for our students. And the other aim of a school ed program is to ensure a healthful environment. And a healthful environment is one that is risk free or is free from injuries, it's free from mental breakdown, it's free from fatigue or any other risk that can hinder the growth and development of the students while they are in school. So, this is one of the aims. The other aim is to ensure integration, and by integration is school health program aims to integrate the school health program with other health service delivery systems. Remember, we've said even in schools you can provide healthcare services, and these could vary from immunization, nutrition, physical examination, treatment, and care. And these are all integrated services. Remember, the core mandate of a school is to actually learn and teach. But now, here you are, you want to incorporate a school health aspect. So, for this purpose, the school health program can actually help integrate or can actually work around and integrate health service delivery system in the school, immunization, deworming, physical examination, and activities. All these can be integrated by the use of a school health program. And the other aspect of a school health program can help us aim at research. Now, research is a new developing era in school health, and it's a place that is very key because with research, you can identify the need for the needs, the thematic needs for the students. And with the ability to identify these thematic needs of the student, then you can come up with well-informed programs or well-informed initiatives that can help intervene on any cases or areas that needs interventions or needs implementation approaches. And for this purpose, Promotion of research and development in the field of school health and student will help promote the general well-being of not only the school, but it will also promote growth in terms of innovation, in terms of technological advancement, and even it can bring in interventional approaches that are groundbreaking and can change the whole aspect of school health as a whole specialization. Other aim is school development, looking at fresh, whereby we're talking about focusing resources for effective school health. The main agenda is to promote skills. And with skill development, with a good school health program, you can have enhancement of skills of teachers, you can have enhancement of skills of the children, you can also have skill enhancement for the personnel who are in this school. And with the enhancement of these skills, it means that teachers become better in handling the health and developmental program of our children. Remember, we have special needs children who have either disability or who have different incapacitations. And with this, if teachers can handle or can early detect these deviations of our children in development, then it becomes even more effective on how to take care of them. So, school health program can actually help us do this. The other target of school health program is to guide and counsel. So with guiding and counseling, the school health program provide guiding not only for establishment and maintenance of school health clubs, they can also help in guiding on development of curriculums. They can help in guiding on development of policies. School health programs can also guide teachers on how to handle behaviors of students who are maybe defiant or students who have issues with understanding of skills or literacy or all these cognitive challenges among students. So it plays a very key role when it comes to guiding and counseling for students because they also come in with initiative that let's say look at promoting mental health of students. Some of them come with behavioral change approaches like prevention of HIV and AIDS or prevention of substance abuse, prevention of bullying and gender-based violence in all these possible thematic areas. The other purpose is disease prevention. So remember, as a school, this is a community that brings in different children from different origin and background. And with this setup, there's risk for congestion or there's risk for infection prevention. And for this purpose, you can have preventive services that can be provided through school health to protect the students. You can implement activities such as deworming, you can do screening, you can have immunization approaches, you can implement dietary interventions that can prevent malnutrition, and all these are different ways of preventive approaches for disease prevention. And the other part is early diagnosis, treatment, and follow-up. And the aim of this aspect is to ensure the ability to identify and correct problems among school-going children, including psychological problems, issues to do with substance abuse, HIV and AIDS, peer pressure, and so on. So remember, being a school, we're saying it's a community and it brings in different community setups, it brings in different students from different backgrounds, and so there's risk of mingling, there's risk of infection, there's risk of also contact, and so on. And for that purpose, with early diagnosis and detection, we're able to treat the student and follow up. So can identify any manifesting problems among the students. And some of them could either substance abuse and addiction. Some students suffer from defiance disorders. Other students suffer from learning disorders. If you're able to tell this on time via school health programs, then it's an advantage because interventions can be done on time and the problems can be rectified. And the other bit is counseling. So guidance and counseling can be done to students with any special illnesses or problems or students with disability or have issues adapting to the school environment. For instance, first-timer students are known to suffer readjustment issues or readjustment syndrome. And for this purpose, with provision of counseling, then they are able to to fit in and adjust to the settings and be able to focus on the learning. And lastly, we have health education. And with health education, we define it as an aspect whereby we are able to provide information to our students that can guide their day-to-day living in the school, help them make proper decisions, get them be informed, and even protect themselves from risks that can make them either fall prey of diseases or behaviors that may be detrimental to them. So with health education, you can establish this by either developing or distributing health education materials. You can also provide media to schools or media for learning to provide health information. So all these are the different aims, from counseling to health education to early diagnosis to disease prevention, all the way to guidance and so on. And so if this is your area of interest, don't forget to click on the subscribe button. Share this work with your friends and community. You can comment and also remember to like our videos. And till next time, bye bye. And my name is Winnie Barawa.